What's up, TUMNAD lectures? In this video, we are looking at what we call the brain circulation. If you find this video helpful at the end of it, please make sure you like the video, comment down in the comment section, please subscribe. Let's go ahead and get started. So now we are going to be looking at what we call the basics of what we call the blood circulation. It's going to be a complex bit of what we call the concept, but we shall try to simplify it in the simplest way possible for better understanding. Let's go ahead and get started. So, to start it off, brain circulation, we are trying to mean the movement of the blood to and from the brain. It's all that simple, okay? We are moving the blood to the brain and then we are draining it back. Now, the question is, how much blood goes to the brain in every single minute which passes, okay? But we know that cardiac output is going to be what we call stroke volume times what we call heart rate. And when we talk about the stroke volume, this is the volume of the blood pushed out of the heart every kind of the beat. And it is generally close to around 70 mils every kind of the beat. And of course, you know that heart rate, these are the number of the beats the heart can make in a minute. And they are close to around 72 beats per minute. Okay, so now when you have this kind of the simple kind of the mathematics, we shall end up with approximately around 5,040 mils that which is going to be the cardiac output. It means that every minute which passes, the heart can push out 5,040 milliliters every minute. Now the question is, out of these 5,040 milliliters, how much goes what we call to the brain every minute that passes? Now, it is generally close to around 15% of the total cardiac output. Now, what is the 15% of the total cardiac output on what we call the 5,040 milliliters? So we are going to be having what we call the 15 out of 100 times 5,040 milliliters. And this one generally it is going to give us what we call close to around 756 mils. What does this one mean? It means that close to around 756 milliliters circulate to the brain every single minute that passes. That is a basic concept to know. Okay? It is such another beautiful thing to know as a basic concept. Now, blood circulation to the brain is going to be having two kind of the systems. You're going to be having the blood circulate to the anterior portion, that's going to be one of the system, and then also going to be having that kind of the system which is going to be circulating the blood to the posterior aspect of what we call of the brain. In other words, we have two kind of the systems of what we call the blood supply. The first one is what we call the anterior circulation. Okay, what we call the anterior circulation. And then the second one is what we call the posterior, circulation. Okay, and when we talk about the anterior circulation, we are meaning that we are circulating blood to the front parts of the brain. Okay, and when we talk of the posterior circulation, we are circulating the blood to what we call the back of what we call of the brain. So now let's go ahead and dive deep into this kind of the systems, and we see what happens exactly. Okay, so now we are taking a look at what we call this type of the circulations, the anterior circulation and then the posterior circulation. Now, when we come with what we call the anterior circulation, the primary kind of the artery which is going to be aiding in what we call the anterior circulation is what we call the internal carotid artery. Okay, is what we call the internal carotid artery. Okay, this is going to be the main kind of the artery which is going to be helping in the feeding of what we call the anterior portions of what we call of the brain. But this internal carotid artery, it has multiple of different kind of the branches. What are the branches of what we call the internal carotid artery? Okay, so now we are looking at what we call the branches. Okay, what we call the branches. The first one is what we call the anterior cerebral artery. Okay, that is going to be now the first kind of the branch of what we call the internal carotid artery. The second kind of the branch is what we call the middle cerebral the middle cerebral artery. Okay, and then the third one is what we call the ophthalmic, ophthalmic, what we call ophthalmic artery. Okay, another kind of the branch is what we call the posterior communicating artery. Okay, another kind of the branch is what we call the posterior communicating, communicating artery. Okay, so now these are going to be the major kind of the branches of what we call the internal carotid artery. Now the question is, what are some of those areas they are going to be supplying? Okay, what we call the supply areas. What we call the supply areas. Now these kind of the branches are going to be supplying the following kind of the areas. They are going to be supplying different areas on what we call frontal lobe, different structures within the frontal lobe. Also what we call the parietal, okay, what we call the parietal lobe, okay. They are also going to be supplying what we call the eye, okay, what we call the eye, or what we call the orbit, and even also deeper, what we call the deeper brain structures, okay. And when we talk of the deeper brain structures, we are going to be reflecting on what we call, for example, what we call the internal capsule, okay. We have what we call the basal ganglia, okay. We have what we call the caudate nucleus, We have what we call the corpus callosum, okay, the corpus callosum. So now these are the deeper brain structures. So now all these areas are going to be supplied by the different branches of what we call the internal carotid artery, as we have just seen below. Okay, so now having seen what we call the anterior circulation, let's take a look at what we call the posterior circulation. It's going to be circulating the blood to the back of what we call the brain. The primary kind of the artery or the arterial system which is responsible for what we call the posterior circulation is what we call vertebro-basilar arterial system. Okay, this one here is what we call a vertebro-basilar system. Okay, what we call vertebro-basilar system. Now, when we talk of vertebro-basilar system, this system is made up of two kind of the arteries. It is made up of what we call the vertebral arteries and even also what we call the basilar artery. Okay, so now it's going to be containing what we call vertebral artery, and even also what we call the basilar artery. Now, the right and then the left vertebral arteries, when they come together, they form what we call the basilar artery. The basilar artery is going to be one. Okay, so now having seen that, let's go ahead and look at what we call the different kind of the branches of what we call the vertebro-basilar system. Okay, we shall start with what we call the vertebral branches. Now, when we talk about the vertebral branches, the first one is what we call the anterior spinal artery. Okay, that one is going to be supplying approximately around the two sides of what we call the spinal cord. Okay, and then the second one is what we call the posterior inferior cerebellar artery. Okay, which at times is written as what we call the pica. Super very important. Okay, and then another one is what we call the posterior spinal artery. And of course, when we talk about the posterior spinal artery, going to be supplying approximately the third of what we call of the spinal cord, is going to be generally coming off from the branch on what we call the posterior inferior cerebellar artery. Okay, it is such a beautiful thing. So now these are going to be the major kind of the branches on what we call the vertebral branches. Okay, so now let's take a look at what we call the basilar branches. Now the basilar branches, the first one is what we call the anterior inferior cerebellar artery. Okay, which at times can be written as what we call the ICA. okay, which can also be written as what we call the ICA, okay. Another one is what we call the labyrinthine, okay, what we call the labyrinthine, okay, the labyrinthine artery. Okay, what we call the labyrinthine artery, which some other people can call what we call the internal auditory artery, or what we call the internal acoustic artery. Okay, super very important. And then another one is what we call the superior cerebellar artery. Okay, what we call superior cerebellar artery. Okay, and then another one is what we call the posterior what we call the posterior cerebral, okay, posterior cerebral artery, okay. And another one is what we call the pontine, okay, is what we call the pontine artery, okay, what we call the pontine artery. So now these are some of what we call the branches of what we call the basilar artery, okay. It is such another beautiful. So now what is very beautiful is that the internal carotid artery and then the vertebrobasilar system are the base of the brain around what we call the optic chiasm and what we call the pituitary stalk. They are going to be interconnected to make what we call a ring-like structure arrangement. And that kind of the ring-like structure arrangement, which is going to be as a result of interconnection between the internal carotid artery and what we call the vertebrobasilar system, that kind of the ring-like structure is what we call the sac of wheels. Okay, it is such a beautiful thing. We shall take much little of the time and understand what we call the sac of wheels. Okay, so now that briefly covers the basic concept on what we call the brain circulation. Now in the next video, we are going to go ahead and look at what we call where is the internal carotid artery originating from, and where is the vertebral artery and then the basilar artery, where are they going to be originating from. At the back of your mind, you have to know that on the aortic arch, you have three kind of the great vessels. These are the three great vessels that are going to be giving us origin of this kind of the internal carotid artery and what we call the vertebral artery, and what we call the subclavian artery, and then also what we call the common carotid arteries. Okay. Now that we have seen the different branches of what we call the vertebral branch and what we call the basilar branch, what are those areas of these branches? Where are they going to be supplying exactly? They are going to be supplying the following areas. Okay, so what we call the supply areas. They are going to be supplying the following areas. They are going to be supplying what we call the brain stem. Okay, what we call the brain stem. They're going to be supplying what we call the occipital parts of what we call the occipital lobe. Okay, and even also what we call the cerebellum, and even also some little bit of what we call the temporal lobe. Okay, of what we call the temporal lobe. Okay, so now those are the key important areas where all these kind of the branches are going to be supplied. Okay, all that one makes a lot of sense. Okay, so now TUMNAD, in this video we have covered the basic concept on what we call the brain circulation. And if you think whatever I have talked is making sense, is adding to you, you are benefiting, you guys know the deal. You hit like button, comment down in the comment section, and please subscribe. As always, TUMNAD, until we meet next time.